You've probably heard the buzz about digital healthcare. It's a trend that's popping up throughout the world of rehab in the form of online MSK clinics, digital health platforms, and remote therapeutic monitoring. Although it can sound like a futuristic science fiction film, it is being used today to help clinicians better meet the needs of their patients in an increasingly online world. Digital care is here to stay, and it's important that you be able to meet your patients where they are in terms of these technologies. It can be a lot to sort through, but in this video, we'll walk you through what digital healthcare is so you can understand how it impacts the care you provide. Simply put, digital care is an umbrella term for any instance where digital technology is used to help deliver care. It can be as simple as assigning a home exercise program through an app, or having a telehealth call, or as complex as using computer vision to analyze a patient's movement. Sometimes it feels like this technology is here to replace the work of the clinician, but in reality, it augments your abilities and helps you provide even better care. This is largely because it's giving you more touch points and data about your patient. Rather than being limited to in-person visits, you can now interact with your patient using digital tools. These tools can break down barriers to communication and care that you've previously experienced. Let's take a look at 2 episodes of care to better understand how digital care compares to traditional patient care. First, let's look at a traditional physical therapy episode of care. This is Bill, and you've probably worked with hundreds of patients like him in your career. Bill has chronic low back pain, and he was referred to you for physical therapy. On Monday, Bill comes in for an evaluation. You might perform some manual therapy and walk him through some exercises. Before he heads home, you give Bill a home exercise program and schedule a follow-up appointment for next week. As he progresses, this process repeats. Bill comes in the next Monday for a visit, and you ask if he's completed his exercises. You provide treatment and answer any questions he may have. Then you schedule a follow-up appointment and send him home with some new exercises. This process continues until you discharge Bill. Or, as happens all too often, he simply stops coming to his appointments and drops off. Sounds familiar, right? Now let's look at a physical therapy episode that incorporates digital health tools. This is Laura. She injured her knee in a cycling incident and was referred to you for physical therapy to help her get back on her wheels? Back on her feet? Anyway, the process starts in the same fashion. On Monday, Laura comes in for an evaluation, but at the end of the appointment, rather than just giving her a printout with her exercises, you assign her a digital home exercise program and enable remote therapeutic monitoring. Her digital home exercise program includes videos of her exercises and can be conveniently accessed from an app on her phone. When Laura gets home, she follows along with videos of her program and can log how many sets and reps she completes. Back at your clinic, you can see how many exercises she's completed in real time. Let's say on Wednesday, Laura wakes up feeling more pain than she's used to. She can send you a quick message to let you know, and based on her feedback, you can modify her program right away. She sends you another message on Friday to let you know the new exercises are great and that she's feeling less pain, and you tell her to keep up the good work. Because you've already progressed her home program, you have more time to focus on treatment during her follow-up appointment on Monday. The long and short of it is that traditional and digital care are very similar, but with digital care, you can get more touch points with your patients and can build stronger relationships with them. It's difficult to form strong bonds with patients when you only see them for an hour a week. But if you can message patients or conduct a telehealth call between visits, you're able to form stronger relationships with them more quickly. The APTA notes that deploying digital tools in practice can potentially increase patient access to care and drive better patient engagement outside the clinic, helping patients reach their goals faster. One organization even saw a 27% improvement in photo effectiveness scores by implementing a digital care solution. Learning to embrace digital care tools to augment your practice can provide huge benefits to you and your patients. And Medbridge has a variety of resources to help you become a digitally enabled clinician. Visit our course catalog for more tips on implementing digital care.